In the Middle Ages, life was brutally short. What we often imagine as an age of castles, knights, and honor was for most people a constant fight for survival. Growing old was rare. Many never reached adulthood at all. A person who lived past 40 was already considered old. The low life expectancy of medieval people was not mainly caused by war or violence. It was caused by everyday life itself. Death often began at birth. Childhood was the most dangerous stage of life. Around 1/3 of all children died before the age of 5, and in some regions the number was even higher. Childbirth was extremely risky. There were no sterile tools, no understanding of infection, and no reliable medical knowledge. Complications during labor frequently killed the baby, the mother, or both. Surviving infancy did not mean safety. Disease was everywhere. People had no idea what bacteria or viruses were. They believed illness came from bad air, evil forces, or divine punishment. Common diseases that are easily treated today were often deadly. A simple fever could kill. Pneumonia, tuberculosis, dysentery, and smallpox spread rapidly through towns and villages. Medical treatments were primitive and often dangerous. Bloodletting was widely used. Herbal remedies were based on superstition rather than science. Many treatments weakened the patient instead of curing them. Epidemics could destroy entire populations. When the Black Death spread across Europe, it killed up to half of all people in some areas. Healthy individuals could become sick and die within days. There was no cure. There was no real prevention. Doctors did not understand what caused the disease or how to stop it. Even those who survived plague faced constant danger. Living conditions themselves were deadly. Clean drinking water was rare. Most people drank from rivers and wells, polluted with waste. This caused frequent outbreaks of intestinal diseases. Food was another serious risk. Meat spoiled quickly. Grain was often stored poorly and became moldy. Some molds produced toxins that caused severe illness, convulsions, hallucinations, and death. Famine was common. A single failed harvest could lead to mass starvation. Malnutrition weakened the body and made people more vulnerable to disease. Even small injuries could be fatal. A minor cut, a burn, or a splinter could become infected. Without antiseptics or antibiotics, infections spread rapidly. What would be a minor wound today often meant death in medieval times. People rarely died suddenly. They died slowly from infection, exhaustion, and illnesses no one knew how to treat. War added another layer of danger. Conflicts between kingdoms and lords were frequent. Most soldiers were not professionals, but ordinary men forced into battle. Weapons caused deep wounds that were almost impossible to heal. Many who survived the battlefield died later from infection or blood poisoning. Civilians suffered as well. Armies destroyed crops, burned villages, and spread disease. War often led directly to famine and epidemics. But even in times of peace, life was physically destructive. Most people worked from sunrise to sunset. Farming, mining, construction, and blacksmithing required extreme physical effort. Years of hard labor wore the body down. Bones weakened, joints failed, teeth rotted. There was no real rest. If you could work, you worked. If you could not, you became helpless. Accidents were common. Broken bones, crushed limbs, and head injuries were often fatal or permanently disabling. Nutrition made everything worse. The diet of most peasants was poor and repetitive. Bread and porridge made up most meals. Meat and fresh nutrients were rare. Poor nutrition weakened the immune system and slowed recovery from illness and injury. For women, life was especially dangerous. Pregnancy and childbirth were among the leading causes of death. Many women gave birth multiple times, and each pregnancy increased the risk of fatal complications. There were no painkillers, no surgical knowledge, and no hygiene standards. Even time itself worked against people. Medieval life placed enormous stress on the human body from an early age. Children began working young, sometimes as early as 6 or 7 years old. Their bodies never had a chance to fully develop before being pushed to exhaustion. Bones grew under constant strain. Spines bent under heavy loads. Chronic pain became normal long before adulthood. There was no concept of long-term health. If something hurt, you ignored it. If you were sick, you worked anyway. Stopping meant falling behind, and falling behind often meant starvation. Sleep offered little recovery. Homes were cold, damp, and overcrowded. Families lived in a single room, often with animals. Smoke from open fires filled the air, damaging lungs over time. Respiratory diseases were common. Coughing was constant. Breathing problems worsened with age and cold winters. Hygiene was extremely limited. Bathing was rare. Clothes were washed infrequently. Parasites such as lice, fleas, and worms were widespread. These parasites weakened the body and spread disease. They were an accepted part of life. Dental health was another silent killer. There was no dentistry. Teeth decayed quickly due to poor nutrition and lack of cleaning. Infections in the mouth could spread to the bloodstream. Tooth pain was unbearable. Extraction, if attempted, was done without anesthesia. Many people died from infections that began in their teeth. Seasonal changes were deadly. Winter brought cold, hunger, and disease. Heating was limited. Food supplies ran low. People weakened during winter months, making them easy targets for illness. Many did not survive until spring. Summer brought its own dangers. Heat spoiled food faster. Water sources became stagnant. Disease spread rapidly. Flies and insects carried infection from waste to food. There was no protection against this. Social class determined survival. Nobles lived longer than peasants, but even they were not safe. They had better food and shelter, but still lacked modern medicine. Even kings died young. A minor illness, an infected wound, or food poisoning could kill anyone, regardless of status. Peasants, however, had almost no protection at all. They lived closest to animals, waste, and contaminated water. Their diets were the poorest. Their work was the hardest. For them, survival was a daily gamble. Punishment and justice added another threat. Harsh laws were enforced through physical punishment. Whippings, mutilation, and executions were common. Injuries from punishment often became infected. Even surviving the sentence could result in death weeks later. Superstition made things worse. People feared witches, curses, and omens. Those accused could be tortured or executed. Medical conditions were sometimes mistaken for possession or sin. Instead of treatment, people faced violence. Mental illness was especially dangerous. Those who behaved differently were feared. They were isolated, punished, or killed. There was no understanding, only judgment. Aging itself was brutal. Without pain relief, arthritis and joint disease caused constant suffering. Vision worsened. Hearing faded. Old age meant weakness, and weakness meant dependence. Many elderly people died not from disease, but from neglect. They could no longer work, and society had little use for them. Community support existed, but it was limited. If a family was poor, there was no backup. If crops failed, hunger followed. If disease spread, death followed. There were no institutions to protect the vulnerable. Religion shaped how people viewed death. Life was seen as temporary. Suffering was believed to have meaning. Death was not feared as much as it is today. This acceptance helped people endure, but it also prevented change. There was little effort to improve living conditions. Pain was expected. Early death was normal. From birth to death, life was surrounded by risk. Not one single factor caused people to die young. It was the accumulation of everything. Disease weakened the body. Hunger drained strength. Labor destroyed joints and muscles. War and violence struck without warning. Luck decided who survived. Luck to be born healthy. Luck to avoid infection. Luck to live through childhood. Luck to escape famine and war. Most people ran out of luck early. When we look back at medieval times, we often focus on castles, armor, and legends. But the true medieval experience was fragile, exhausting, and short. For most people, life was not about dreams or ambitions. It was about enduring one more day. And that is why dying young in the Middle Ages was not a tragedy in the eyes of society. It was simply how life worked. Compared to modern life, the Middle Ages were not just harsh. They were unforgiving. What we now consider basic, clean water, medical care, hygiene, stable food supply, were luxuries most medieval people never experienced. And that is why for most people living in medieval times, reaching old age was not normal. It was a rare and fragile miracle.